Hey everyone, welcome to Decode with Swathi. This is our space beyond all the noise. So, if you're ready, let's decode this together. For the very first episode, we have Dr. Jyotsna Mirlay, who has almost 25 plus years of experience into gynecology and also a specialist in menopause and perimenopause issues. So, let's get into it. So, ma'am, thank you so much for this opportunity.
Welcome, Swathi.
So to be very frank, I'll just start with my personal experience and then
Sure.
we'll go ahead.
Sure.
So when I started having this mood swings or, I was not myself. So when I started speaking to people, they were not actually, to be frank, supportive. They were like, no, you're just overthinking or this is in your head. And
Yes.
all these people were my friends, colleagues who
Yes.
are educated.
Yes.
So that's when I thought there's a gap
Yes.
which has to be filled.
Absolutely.
And that's when I started approaching you, and
Yes.
it completely changed how I looked
I'm
at
so
it.
happy. I'm glad that it helped.
Thank you, ma'am. So on an average, I can say 6 in 10 women go this, and they are aware of symptoms, but they're not ready to accept it.
Yes. So menopause and perimenopause awareness ಅಂದ್ರೆ ಋತುಬಂಧದ್ದು ಆಮೇಲೆ ಪೆರಿಮೆನೋಪಾಸ್ದು ತಿಳುವಳಿಕೆ ನಮ್ಮ ಸಮಾಜದಲ್ಲಿ ಅಷ್ಟೊಂದಿಲ್ಲ. ಸೊ ಬೋತ್ ದ ವುಮನ್ ಹರ್ಸೆಲ್ಫ್ ಮಹಿಳೆಯವ್ರಿಗೂ ಆ್ಯಂಡ್ ಸೊಸೈಟಿ ಸಮಾಜಕ್ಕೂ ಇದ್ರ ಬಗ್ಗೆ ಜಾಸ್ತಿ ನಾಲೆಜ್ ಇಲ್ಲ. ಸೊ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ಓಪನ್ ಆಗಿ ಅದ್ರ ವಿಚಾರ ಡಿಸ್ಕಸ್ ಮಾಡಕ್ಕೆ ಒಂಥರ ಹೆಸಿಟೇಷನ್ ಇರುತ್ತೆ. And there is hesitation on the part of the woman also and on the part of the people around her, whether it is family nalli irbahudu or at workplace, office alli irbahudu. How to help a woman who is having changes in the way she is because of hormonal changes is difficult for her to express and for the people around her to understand, and all this is because of lack of awareness. ತಿಳುವಳಿಕೆ ಇಲ್ಲದೆ ಇರೋದ್ರಿಂದ ಈ ಕಷ್ಟಗಳು ಬಂದಿವೆ.
Yeah. Ma'am, let's start with basics. Actually, ತುಂಬಾ questions ಬಂದಿದೆ.
Sure.
So we'll understand the basics. Perimenopause ಗೆ menopause ಗೆ difference ಏನು?
Okay. So perimenopause ಅಂದ್ರೆ it is the time before menopause. Menopause ಅಂದ್ರೆ ಏನು? It's a day in your life. ಅಂದ್ರೆ suppose ನಿಮ್ಗೆ last period July 3rd of 2026 2025 ಅಲ್ಲಿ ಬಂದಿದೆ ಅಂದ್ರೆ 2026 ಜುಲೈಗೆ ನೀವು ಹೋದ್ರೆ ಡಾಕ್ಟರ್ ಹತ್ರ ಅವ್ರು ಹೇಳ್ತಾರೆ ಹೌದಮ್ಮ 12 months. It's been 12 months since you had your last period. You are now menopausal anta we can understand. So the period of time before this, that is starting from the late 30s, 38, 39 onwards till 48 or 50 is called perimenopause. During this time you can still continue to have your periods. Adu regular irbodu, irregular irbodu, but periods barutte. But you'll have lots of other symptoms of perimenopause. Menopause is stopping of the periods, and the time that follows menopause is postmenopause, which is the large part of the woman's life. So if a woman is menopausal at 50, adadmele 50 to whenever she is going to live, that will be the postmenopausal stage of her life.
Okay. So ಈಗ perimenopause phase ಅಲ್ಲಿ like when they stop periods, like ಅಂದ್ರೆ it will be there, like ಈಗ 2 months ಇರುತ್ತೆ, 2 months ಇರಲ್ಲ.
Yes. Yes.
It doesn't stop at
No.
sudden point.
No. It is irregular. Perimenopause is irregular periods. Menopause is stopping. Total stopping of period is menopause.
Okay. ಈ perimenopause ಅಲ್ಲಿ flow ಏನಾದ್ರು affect ಆಗತ್ತಾ ಮ್ಯಾಮ್?
Yes. ಪೆರಿಮೆನೋಪಾಸ್ ನಲ್ಲಿ ಫ್ಲೋ ಯಾತಕ್ಕೆ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ ಅಂದ್ರೆ ಈ ಹಾರ್ಮೋನ್ಸ್ ಇದು ಫ್ಲಕ್ಚುಯೇಷನ್ ಇರುತ್ತಲ್ವಾ, ಈಸ್ಟ್ರೋಜನ್ ಅಂಡ್ ಪ್ರೊಜೆಸ್ಟ್ರಾನ್ ಹಾರ್ಮೋನ್ಸ್ ನಾಟ್ ಓನ್ಲಿ ಅದು ಕೆಳಗೆ ಬರ್ತಾ ಇರುತ್ತೆ ಲೆವೆಲ್, ಬಟ್ ಅದು ಅಲ್ಲೂ ಮೇಲೆ ಕೆಳಗೆ ಹೋಗ್ತಾ ಇರುತ್ತೆ. ಇದರಿಂದ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ಇಟ್ ಎಫೆಕ್ಟ್ಸ್ ದಿ ಯೂಟ್ರಸ್ ಲೈನಿಂಗ್. ಸೊ ಸಮ್ ವಿಮೆನ್ ಮೈಟ್ ಹ್ಯಾವ್ 2-3 ತಿಂಗಳಿಗೆ ಒಂದ್ಸಲ ಪೀರಿಯಡ್ ಅಂಡ್ ಇಟ್ ಮೈಟ್ ಬಿ ಸ್ಟಿಲ್ ನಾರ್ಮಲ್ ಫ್ಲೋ. ಕೆಲವರಿಗೆ 1 month ಅಲ್ಲಿ 3-4 ಸಲ ಬರಬಹುದು ವಿತ್ ಓವರ್ flow. So ಈ ತರ the fluctuation of hormones can affect the timing of your periods and the amount of flow you have, and this happens very typically in perimenopause.
Okay. So when usually people come to you, what is the common symptom you have observed, ma'am?
So perimenopause nalli there are lots of women who come with actual symptoms which can be either menstrual. So lot of women do come to me with bleeding that seems to be a little excessive compared to what they had. This is quite a common symptom. The other more common symptom that I'm seeing is tiredness. Some of them have mood changes, sleep disturbances, weight gain, and then the typical like sweating, brain fog, ಅಂದ್ರೆ ಮರ್ತ್ ಹೋಗೋದು, memory loss. These are some of the common things that I have seen women tell me about when they come to meet me in perimenopause.
Okay. So, eager, they all know these are the symptoms. And
Yes.
should they be worried? Should they consult a doctor, or it's fine not to?
No, I think they have actually gone to several doctors before they come to me, because perimenopause symptoms ಹೆಂಗಿರುತ್ತೆ ಅಂದ್ರೆ it is very vague. It's not pertaining to gynecologist. So ಇವಾಗ ತುಂಬಾ ಮೂಡ್ ಚೇಂಜಸ್, ತುಂಬಾ ಅಳು ಬರೋದು, ತುಂಬಾ ಫೆಟಿಗು, ಸುಸ್ತಾಗೋದು ಅಂದ್ರೆ ಪ್ರಾಬಬ್ಲಿ ನೀವು ಗೈನಕಲಾಜಿಸ್ಟ್ ಹತ್ರ ಹೋಗಲ್ಲ, ಮೇ ಬಿ ನೀವು ಫಿಸಿಷಿಯನ್ GP ಹತ್ರ ಹೋಗ್ತೀರಾ. ಸೊ ಇಟ್ಸ್ ಓಕೆ, ಪೀಪಲ್ ಗೋ ಅಂಡ್ ಸಿ ಡಿಫರೆಂಟ್ ಡಾಕ್ಟರ್ಸ್ ಬಿಫೋರ್ ದೇ ರೀಚ್ ಮೀ, ಬಟ್ ದೇ ಆಲ್ ನೋ, ಅವ್ರಿಗೆಲ್ಲ ಗೊತ್ತು ನಂಗೆ ಆಗೋದು ನಾರ್ಮಲ್ ಅಲ್ಲ, ಇದು ನನ್ ನಾರ್ಮಲ್ ನ ಮೀರಿ ಆಗ್ತಾ ಇದೆ, ಸೊ ಐ ಬೆಟರ್ ಗೆಟ್ ಹೆಲ್ಪ್ ಅಂತ ದೇ ಹ್ಯಾವ್ ಸೀನ್ ಡಾಕ್ಟರ್ಸ್. ಅಂಡ್ ಐ ಥಿಂಕ್ ಇಟ್ಸ್ ಅ ಗುಡ್ ಐಡಿಯಾ. ಇಫ್ ಯು ಬ್ಲೀಡಿಂಗ್ ಇಸ್ ಮೋರ್ ದೆನ್ ನಾರ್ಮಲ್, ಪ್ಲೀಸ್ ಸಿ ಅ ಡಾಕ್ಟರ್. ಇಫ್ ಯು ಆರ್ ಅನೇಬಲ್ ಟು ಸ್ಲೀಪ್, ನಿದ್ದೆನೆ ಬರ್ತಾ ಇಲ್ಲ ಅಂದ್ರೆ ಪ್ಲೀಸ್ ಸಿ ಅ ಡಾಕ್ಟರ್. ತುಂಬಾ ಮೂಡ್ ಚೇಂಜಸ್ ಇದೆ, ಪ್ಲೀಸ್ ಸಿ ಅ ಡಾಕ್ಟರ್. ಸೊ ಎಲ್ಲ ಪೆರಿಮೆನೋಪಾಸ್ ಸಿಂಪ್ಟಮ್ಸ್ಗೆ ನಿಗ್ಲೆಕ್ಟ್ ಮಾಡೋದು ಕರೆಕ್ಟ್ ಇಲ್ಲ. ಯು ಶುಡ್ ಗೋ ಅಂಡ್ ಮೀಟ್ ಅ ಡಾಕ್ಟರ್, ವಿಚ್ ಎವರ್ ಇಸ್ ದ ಡಾಕ್ಟರ್ ದಟ್ ಯು ಆರ್ ಮೋರ್ ಕಂಫರ್ಟಬಲ್ ವಿತ್, ಅವರನ್ನು ಹೋಗಿ ಭೇಟಿ ಮಾಡಿ.
Okay. So, either they come and approach you and they ask for some treatment, like either lifestyle changes
Correct.
or supplements, everything.
Correct.
So, how does it help, ma'am? Because like hormonal fluctuations is not in our hands.
Correct.
So, how will these things help? Will it reduce
Yes.
the pain or?
Yes. So, what Swathi says has a point. She's saying that we know that most symptoms of perimenopause are related to hormone fluctuation and reduction of hormone levels. Hormone fluctuations ಇಂದ and estrogen progesterone hormones ಕೆಳಗೆ ಬರ್ತಾ ಇದೆ ಲೆವೆಲ್, ಇದರಿಂದ ನಮಗೆ ಸಿಂಪ್ಟಮ್ಸ್ ಬರೋದು ಪೆರಿಮೆನೋಪಾಸ್. ಬಟ್ ನಾನು ಯಾವಾಗಲೂ ಪೇಷಂಟ್ಸಿಗೆ ಅಂತೀನಿ, ಜೀವನ ಶೈಲಿನಲ್ಲಿ ನೀವು ಚೇಂಜಸ್, ಬದಲಾವಣೆಗಳು ಮಾಡಬೇಕು. ಚೇಂಜ್ ಆಫ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಇಸ್ ಇಂಪಾರ್ಟೆಂಟ್. ಸಮ್ ಅಮೌಂಟ್ ಆಫ್ ವಿಟಮಿನ್ಸ್ ಅಂಡ್ ಸಪ್ಲಿಮೆಂಟ್ಸ್ ವಿಲ್ ಹೆಲ್ಪ್. ಅದೇನ್ ಕನೆಕ್ಷನ್ ಹಾರ್ಮೋನ್ಸ್ಗೂ ಇದಕ್ಕೂ ಅನ್ನೋ ಶಿಲ್ ಆಸ್ಕಿಂಗ್ ಮಿ. ಸೊ ಎಸ್, ದೇರ್ ಇಸ್ ಅ ಬಿಗ್ ಕನೆಕ್ಷನ್, ಬಿಕಾಸ್ the things that improve whatever the hormones were supposed to do, for example brain fog is, we know for sure, because of fluctuating hormone levels. Yes, we know that, but we also know that brain fog can get worse if you haven't slept well. We know brain fog can get worse if you're very stressed. We know brain fog can get worse if you're eating very poorly, if you're eating too much sugar and having sugar crashes. All of this can result in worsening of brain fog. ಅದಕ್ಕಿಂತ ಬಿಕಾಸ್ ಆಫ್ ದಟ್ ನಾನು ಏನ್ ಹೇಳೋದು ಅಂದ್ರೆ, ಹೌದು ಹಾರ್ಮೋನ್ಸ್ ಇಂದ ನಮ್ಗೆ ಪ್ರಾಬ್ಲಮ್ಸ್ ಬರುತ್ತೆ ಪೆರಿಮೆನೋಪಾಸ್ದು, ಮೆನೋಪಾಸ್ದು, ಬಟ್ ಜೀವನ ಶೈಲಿ ನಮ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಅನ್ನ ಟು ಒಂದು ಹದಕ್ಕೆ ತರುತ್ತೆ. ಅಂಡ್ ಇಟ್ ಅಲೌಸ್ ಅಸ್ ಟು ಲಿವ್ ಅ ಮೋರ್ ಕಂಫರ್ಟಬಲ್ ಲೈಫ್ which supports whatever level of hormones are present in our body without adding to more trouble. Because of that, I feel Jeevan Shaili Badlavane and taking some supplements is very important for perimenopause and menopause.
So basically, it's like it will help us not completely avoid it or like eliminate madakagala.
It's difficult to completely cure, let us say, mood swings and hot flashes with complete lifestyle changes. I will say on a scale of 10, the woman might have an improvement of all the way up to 5 to 6 if she does the appropriate changes in lifestyle, which will help her for even for mood swings and hot flashes and sweats. The last 3 to 4 will need to be with some form of specific treatment like hormone replacement therapy.
Okay, if it goes beyond the limits.
Yes, or if she's not getting better, lifestyle try madidare, but it's working, but it's not ideal. Ivaga sweating irat ಕೆಲವರಿಗೆ, they are trying everything that they know is going to reduce sweating. They go to bed on time, they are working out, they are eating healthy, they're keeping their stress low, but yet sweating is out of proportion. Then you know that ಇದು ಯಾತಕ್ಕೆ ಆಗ್ತಾ ಇದೆ ಅಂದ್ರೆ, the regulation of temperature, ನಮ್ಮ ಬಾಡಿ ಟೆಂಪರೇಚರ್ ರೆಗ್ಯುಲೇಟ್ ಮಾಡೋ ಸೆಂಟರ್ಸ್ಗೆ they need estrogen progesterone. So at some point in time, we do offer hormone replacement therapy in addition to lifestyle changes.
Okay. So, ma'am, one more thing, like ivaga pregnancy andre everyone knows.
Yes.
Like mood swings athwa cravings irutte, avrna take care ಮಾಡಬೇಕು ಅಂತ.
Correct.
But when it comes to this, like most of the women are also not aware.
Yes.
So So this
Yes.
happens, and
Yes.
for
Yes.
instance, I'll just give you an example.
Sure. Sure.
When I said I had mood swings or anything, either my mom or of her age,
Yes.
even they were not ready. ನಮಗೆಂತ ಇರ್ಲಿಲ್ಲ ನಿಮಗೆಲ್ಲಿಂದ ಬಂತು ಇದು
Yes,
ಅನ್ನೋ
haudu,
ತರ.
haudu. That is true. I think also women have been discouraged from expressing themselves too much. And I think the society by itself has not felt it needed that they should support a woman who's going through emotional changes of menopause or perimenopause. Whereas pregnancy is a very the whole society is invested in that woman. Ivaga, the family has to grow, society has to grow. So I think the way that society looks at pregnancy compared to perimenopause is through very different lenses. And you're right, the support she gets then, she doesn't get now, which is very unfair according to me.
Was it not happening before, or they were not aware of it, ಅಥವಾ ಅದನ್ನ ನೆಗ್ಲೆಕ್ಟ್ ಮಾಡ್ತಿಲ್ಲ?
I think there was a lack of awareness. That was the first thing. And Ivaga, suppose you don't talk about something at all, then to open that topic, you almost feel shameful. There's nobody to listen. The person listening also doesn't know how to respond to it. So I think that abhyasa aitu henmaklige, that they will keep quiet. They will just kind of not speak about it. They'll suffer in silence. Anta. So I think that set the tone for several generations. And it's now that women are questioning and advocating for themselves, which I think is a wonderful thing.
Great. So what is one advice you would like to give to women in family, and how should they tell to their partners or parents? And what kind of support parents ಅಥವಾ husband or teenage kids ಅವ್ರು ಹೆಂಗ್ ಸಪೋರ್ಟ್ ಮಾಡಬೇಕು ಈ ಫೇಸ್ ಅಲ್ಲಿ to the woman?
Perimenopause is actually Vantara, the women are sandwiched because they have one side adolescent children to take care of, and on the other side many of them have aging parents. So the responsibilities tumba jaasti irutte perimenopause time nalli. So the best way I would think for the woman to be is to be very vocal. Andre helbeku nange tumba tiredness ide, I'm not able to do such and such thing, munche ಮಾಡಿದ ತರಾನೇ ಮಾಡಬೇಕು ಅಂತ ತಾನೇ ತನ್ನ ಮೇಲೆ ಬಲವಂತ ಮಾಡಿಕೊಂಡು, there is no need to appear to be normal outside but suffering inside. I think it is good to have communication and tell your family that I'm tired, I'm not able to sleep, I can't get up in time. Ask for help wherever it's possible and use whatever resources you can to make your life more comfortable. That would be my advice to a woman in perimenopause. And of course, get medical help when you feel it's needed. Family side in the, I think, ಅವ್ರಿಗೆ probably they need to learn about it. So ಸ್ವಲ್ಪ ರೀಡಿಂಗು, ಇನ್ಫಾರ್ಮೇಶನ್ ಗ್ಯಾದರಿಂಗ್ ಅವ್ರ ಕಡೆಯಿಂದ ಅವ್ರು ಅದನ್ನು ಮಾಡ್ಕೋಬೇಕು, ಸೊ ದಟ್ ದೇ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ದಟ್ ಇವ್ರಿಗೆ ಮಾತ್ರ ಆಗ್ತಾ ಇಲ್ಲ, ಇದು ಸಹಜ ಇದಾಗೋದು, ಸೊ ಈ ಏಜ್ ನಲ್ಲಿ ಹಿಂಗ ಆಗತ್ತೆ, ನಾವು ಹೆಂಗ್ ಸಪೋರ್ಟ್ ಮಾಡಬಹುದು ಅಂತ ಓಪನ್ ಆಗಿ ದೇ ಶುಡ್ ಬಿ ಏಬಲ್ ಟು ಹ್ಯಾವ್ ಅ ಕನ್ವರ್ಸೇಷನ್ ವಿತ್ ದ ವುಮನ್, and in whichever way that helps her, whether it is to do with household chores or companionship or taking her to the doctor or whatever it is, I think it's important that the communication should be good between the partners.
So basically you say women don't become Ma Durga and do everything.
No need.
Ask for help.
ಹೌದು, ವಾಟ್ ಇಸ್ there is no glory ಅಲ್ವಾ, ಯಾರು ನಮ್ಗೊಂದು ಕಿರೀಟ ಕೊಡ್ತಾ ಇಲ್ಲ at the end of it saying that wow you have done so much ಅಂತ. And why should women spoil their own physical, emotional and mental health for trying to appear to be brave and healthy when they are not? I don't think that is needed at all, especially when there is help available now. I would say that all women need to be very expressive and ask for help when it is needed, and the family ಅವ್ರಿಗೂ they have to understand and say ಹೌದು ಹೆಣ್ಮಕ್ಳಿಗೆ ಇದಾಗತ್ತೆ, ನಾವು ಅವರನ್ನ ಸ್ವಲ್ಪ ಸಹಾಯ ಮಾಡಬೇಕು ಅಂತ. I think it's important.
So one word you would say to all the men who have women in their life?
Men, I have no words to say to any man because I don't think they listen. Okay. But if they are going to be watching this and listening, then I would say listen to your wives with an open mind, because the chances that she's speaking the truth and that the chances that she really needs help is very high. So ನಿಮ್ಮ ವೈಫ್ಗೆ ಸ್ವಲ್ಪ ಪೇಷಂಟ್ಲಿ ಕೇಳಿಸ್ಕೊಳ್ಳಿ, ಅವ್ರು ಏನೇನು ಹೇಳ್ತಾರೆ, ಅವ್ರ ಸಿಂಪ್ಟಮ್ಸ್ ಏನಿದೆ, ಅವ್ರಿಗೆ ಯಾವ ಥರ ಹೆಲ್ಪ್ ಮಾಡಬಹುದು ಅಂತ ಅದನ್ನು ಸ್ವಲ್ಪ ಕೇಳ್ಕೊಂಡು ತಿಳ್ಕೊಳ್ಳಿ and ಮಾಡಿ. So that is, I think, would be the best way that you can be there for your wife.
Great. In this journey, like as you say, like nutrition and your health, everything is important.
Yes.
What kind of diet or supplements, how will it help us?
So I'm not a nutritionist, so I
Yeah.
will not be giving very deep advice here. I will just say that eating healthy andre, eat whatever you've been eating all your life. Don't try to change too many things.
Okay.
And follow certain normal guidelines. Avoid too much of sugar, avoid processed foods, avoid unhealthy oils. Stay within limits with things like treats, whatever you feel you want to eat on weekends, chocolates and cakes and such other things, fizzy drinks. Try and keep it very, very limited. Have more of local fresh fruits and vegetables, whatever is grown in your area. Try and consume a lot of that. So that is good for fiber. Fiber is good for gut health. Eat as much protein as you can. If you're a vegetarian, it's a little hard. If you're a non-vegetarian, you can manage to. Protein and fiber are really good for women in midlife. So I would say do that in your natural diet. In terms of supplements, I would say if you feel that you're lacking in calcium and vitamin D, then maybe having those as supplements. Some omega 3 is good. And if you have difficulty sleeping, then I sometimes advise my patients to start on magnesium supplements. So I would say this should be all that you need. You don't need too much of supplements.
Okay. So as per protein wise, like should you say supplements is good or we should keep it as like whatever we eat in our day-to-day food?
So protein supplements, we should remember they are not natural protein. So I don't know for sure how our body actually is helped by synthetic factory made proteins. But for many of us in India, vegetarians, it's hard to meet your protein goals. So many of us do rely on protein supplements. I wish it wasn't necessary. So what I'm trying to say is if you have a mixed diet, ನೀವು ಮಾಂಸ ತಿಂತೀರಾ eggs ತಿಂತೀರಾ ಅಂದ್ರೆ ನಿಮಗೆ protein powder ತಗೊಳ್ಳೋ ಅವಶ್ಯಕತೆ ಇರಲ್ಲ. You may not need proteins if you're going to be able to manage your protein goals. It's not a must. If you're healthy, I mean if you're eating healthy food, ಅದು ಬೇಕಾಗಿಲ್ಲ.
Okay. So what's one advice you would like to give for younger generation who are there in 20s? Like what kind of health they should take care of?
Okay. If you're in your 20s, I think that's the greatest age for you to be in. So I would say 20s to 30s, live healthy, stay healthy, take care of your menstrual health, make sure that you stay clear of infections, genital infections, for example. And I think this is a good time to start exercising seriously, especially weight training, because you're going to have muscle loss muscle and bone loss starts really early for women. Muscle loss starts in your early 30s. So you don't want to enter your midlife with deficit muscle, that where your muscles are already less. Because less muscle means your metabolism is poor, your posture is poor, so many things happen. So I would say exercise regularly, eat healthy, and stay safe. So this would be my advice.
Okay, so when you say about muscle loss, like do we have muscle loss in the menopause and perimenopause?
Yes, in menopause, in perimenopause and menopause, there's lots of muscle and bone loss. The muscle loss is accelerated in late perimenopause. So I would say between the muscle and bone loss both. So I would say in the late 30s onwards, all the way to early 50s, that is the age where you're losing both muscle and bone. So that's the window you have where you should do everything you have to preserve it. To build and grow muscle is very hard for women, but even preservation can be a really good goal to have. So muscles and bone and preserve ಮಾಡೋದು ತುಂಬಾ important so that ಮುಂದೆ fracture risk ಎಲ್ಲ ಕಮ್ಮಿ ಆಗುತ್ತೆ.
Okay. So strength training is the only option?
Strength training is good for preserving muscle and bone strength, but any exercise is good. So if you're doing yoga regularly, it's good for stretching and for mind and all of that. Walking is a good overall exercise, but try and include at least 3 days of strength training so that in a week, so that your muscles don't lose and they don't lose their strength and become really flabby and less. So I think doing some amount of strength training is important.
Okay. Okay. Ma'am, I have recently saw your Get Ready With Me video.
Oh, yeah.
So I would like to talk about that. Like
Sure.
you said, like natural glow is important,
Yes,
or
yes, yes,
hydration,
yes,
and
yes.
your skin is beautiful.
Oh, thank you.
So anything on skin and hair care we should worry about in this phase?
So because again, I'm not a dermatologist or an esthetician, I don't know what is the correct advice to be given for those cares in midlife. Maybe Swathi should do another podcast with experts on this. My, again, very kind of a sensible kind of a approach to this would be that eat something that is going to be healthy and that is going to show on your skin, in your skin and hair. So if you eat a lot of junk food but you put on the most expensive creams and makeup, ಅದು ಹೆಲ್ಪ್ ಆಗಲ್ಲ. ಸೊ ತಿನ್ನೋದನ್ನ ಆಹಾರ ಚೆನ್ನಾಗಿ ಹೆಲ್ದಿ ಪೌಷ್ಟಿಕ ಆಹಾರ ತಿನ್ನಿ, ಆವಾಗ ನಿಮ್ಗೆ ಅಷ್ಟೊಂದು ಮೇಕಪ್ ಪ್ರಾಡಕ್ಟ್ಸ್ ಮೇಲೆ ದುಡ್ಡು ಸ್ಪೆಂಡ್ ಮಾಡೋದು ನೀಡ್ ಇರಲ್ಲ, ಅಥವಾ ಹೇರ್ ಕೇರ್ ಪ್ರಾಡಕ್ಟ್ಸ್ ಮೇಲೆ. ಸೊ ಹೆಲ್ದಿ ಲೈಫ್ ಸ್ಟೈಲ್, ನಿದ್ದೆ ಚೆನ್ನಾಗಿ ಮಾಡಿ, ಸ್ಟ್ರೆಸ್ ಅನ್ನ ಕಮ್ಮಿ ಇಟ್ಕೊಳ್ಳಿ, ಫುಡ್ ಚೆನ್ನಾಗಿ ತಗೊಳ್ಳಿ, ಎಕ್ಸರ್ಸೈಸ್ ಮಾಡಿ. ಐ ಥಿಂಕ್ ದಿಸ್ ಐ ಫೀಲ್ ಇಸ್ ದ ಸೀಕ್ರೆಟ್ ಟು ಗುಡ್ ಸ್ಕಿನ್ ಅಂಡ್ ಗುಡ್ ಹೇರ್. ಅದು ನಂಗೆ ಅನ್ಸುತ್ತೆ.
Okay, so when I say about skincare, like skin tumba dry agate anta is what I heard
Yes.
in this phase. Is
Yes.
it true, ma'am?
Yes, because estrogen is something that takes care of the layers of the skin. So when estrogen level falls, then you can have not only dryness of skin, even redness, because certain parts of the skin can actually become so thin that it might not protect your skin from, let's say, sun rays or allergens. So you might find that pigmentation chance, ರೆಡ್ನೆಸ್ ಬರೋದು, ಇದೆಲ್ಲ ಪೆರಿಮೆನೋಪಾಸ್ ಮೆನೋಪಾಸ್ ಟೈಮ್ನಲ್ಲೂ ಜಾಸ್ತಿ ಆಗೋದು ಚಾನ್ಸಸ್ ಇದೆ.
Okay, okay. And I also heard melasma. It is because
Yes, that is also,
hormonal
yes,
changes.
yes. It causes a little more deposition of melanin. Yeah, so those are changes that can happen with fluctuating hormones.
Okay,
Yes.
okay. So I have few myths and facts, ma'am.
Sure.
So you have to tell us which is a myth and
Okay.
which is a fact.
Okay.
So it only affects you physically.
No, that's a myth. There is a lot of emotional and mental changes as well, and metabolic changes as well. So I would say menopause and perimenopause is more than a physical change.
Okay. So mood swings is nothing but you're becoming depressed or you're going into depression. Is it a myth?
No. Yes, mood swing is nothing but depression is definitely a myth. It's not just about the brain and the nerves and the emotions. There is a huge hormonal component to it. So I would say it's a neurohormonal thing. So we cannot call it as going into depression or something like that. It is something that is completely triggered by the changes in hormones.
So it's a myth.
It's a myth.
Okay. So bone loss speeds up after menopause.
Fact.
It's a
So
fact.
bone loss, yes, bone loss does speed up, especially in the first few years of menopause. So that is why we tell women to do bone density tests. And if it is already showing bone loss, we start certain medications, including hormone replacement therapy.
Okay, okay. So seed cycling, the new trend which I've heard of. So is it a myth or it's a fact? Should we follow that?
I'm completely lost on this. I have not actually studied much about this, but I know it has been helping people to regulate their hormones. So if the seeds have certain chemicals or material in it which supports certain hormones at certain phases in your cycle, then I think it's fine. I mean, it doesn't harm. So if it's going to help you, good for you.
So it depends on case to case.
Yeah, I don't know much about this.
Okay. Okay. So, ma'am, so here we've understood few myths and facts. Now I have few rapid fire questions. So, which were based on the poll which we conducted.
Okay.
One lifestyle change with biggest impact.
Exercise, strength training, 3 to 4 times a week, 40 minutes in those 3 to 4 days. Is the best life-changing decision you can make.
Okay. So, is it possible to get pregnant in menopause phase?
Not in menopause, but in perimenopause, yes, because you can have irregular periods, but that doesn't mean that ovulation will stop. So, nimge perimenopause time nalli makal beda andre you should follow contraception.
Okay. So, weight gain, is it inevitable?
Yes, that it happens because of changes in metabolism and changes in cortisol physiology. There is going to be changes in the way your body looks and feels. So I would say, yes, it's a part of perimenopause and menopause.
Okay, so it's kind of
inevitable. It is there, and it's not something to be ashamed about. It's just the way your body looks. It's reacting to what's happening inside. and there are ways that you can take care of it. Yeah.
Okay. So side effects of this is again cholesterol, sugar levels.
No, I think weight gain of menopause doesn't cause cholesterol and sugar in that sense. High cholesterol and let's say insulin resistance is part of changes of menopause, so and perimenopause. So with weight gain, you're having those things already happening inside you. It's not that you just gained weight and because of that those things happen. Everything happens together. There are changes in your metabolism which result in you having insulin resistance and having higher sugar levels and having slightly changed lipid levels and having fat deposition around your belly. So it's a lot of things that are connected to hormones. So it's hormones and metabolism.
Okay. So cardio or strength training, which
I think both are good. I'm somebody who does a lot more strength than cardio, but I think you should maybe speak to a specialist here because I feel 3 days a week, 3 to 4 days a week strength training is excellent. Cardio, I think more as something to build a little bit of endurance, but not something where you'll punish yourself and run because you put on 2 kgs. I don't think that will help.
Okay. So one supplement you say people underestimate?
For me, it's protein because I'm a vegetarian, and until I started taking supplements, I feel that I was just not able to have enough muscle recovery and do well in the gym. So, for me, I think it's protein and creatine. For me, it's those two are the supplements which I think people actually underestimate.
Okay. How does creatine help, ma'am?
Creatine does a lot of things other than the common things which people understand about recovery of muscles and bone strength and all of that. It also is now known to help with brain health and what we call cognition. So creatine has a lot of benefits to offer for women in midlife, but in doses that are considered to be safe. That is between 3 to 5 grams a day, not more than that.
Okay. That should be again taken under guidance, not an over-the-counter.
No, creatine is a supplement, so you don't need a prescription for
Okay.
this. You can buy it off Amazon as well.
Okay.
But you should just take the scoop that's provided in the box, and that's, I think, a 3 gram scoop. So you should be cautious about not taking too much of it.
Okay. Any brand which you would suggest?
I don't know. I mean, I'm very random when I buy. So
Okay. Okay. Sleep, something which can be fixed or
sleep, yes, there is lots of sleep disruption in perimenopause and menopause, and this is because of several reasons. So what can you do to improve sleep? Number one is have fixed sleep and wake up routine. So it's called sleep hygiene. Don't sleep at different times and wake up at different times.
Okay.
Avoid tea and coffee late in the afternoon. After 4, try and avoid having coffee. And sometimes a magnesium supplement may help, maybe 1 hour before you go to bed. If you have severe night sweats, for example, then you might need to take HRT that can reduce night sweats and bring back sleep.
Okay.
So it's different things for different people.
So when you say HRT, ma'am, does it affect on like your chances of getting cancer increase?
No. HRT, the kind which we give now, hormone replacement therapy or menopause hormone therapy or MHT as it's called, ಇವಾಗ ಕೊಡೋದು ಸೇಫ್ ಮೆಡಿಸಿನ್. ಸೊ ಇದರಿಂದ ಕ್ಯಾನ್ಸರ್ ರಿಸ್ಕ್ ಆಗಲ್ಲ, ಬ್ಲಡ್ ಕ್ಲಾಟ್ ರಿಸ್ಕ್, ಸ್ಟ್ರೋಕ್ ರಿಸ್ಕ್ ಏನೂ ಆಗಲ್ಲ. The studies that were done in the early 2000s were with different set of medicines, and they were oral preparations and synthetic progesterones and estrogen. So that used to have increased risk of cancer, blood clot and stroke. But what we give now don't. So these are very safe, what we call bioidentical formulations.
Okay. Okay. So any regular test you would suggest?
We do lots of tests, including a mammogram, pap smear, bone density test, a lot of blood tests and ultrasound scan to make sure that the uterus is healthy.
Okay. I mean, no, in general, if you're fine and there's nothing to worry about,
then I would say just general blood test to make sure you're not anemic, that your liver is functioning well, your thyroid is functioning well. That's about it. You don't need to go and do too many tests.
Okay. Okay. So one key advice you would say to all the listeners?
If you're in perimenopause, then I would say this is the time for you to work hard at making sure that your health is good now, your symptoms are less now, and that your menopause is going to, and your postmenopausal years are going to be as healthy and happy as you can. So I would say start with improving bone health and muscle health. Take care of your emotions. Make sure that you're eating healthy, you're moving, and you're sleeping, and take care of your stress. So I would say this would be my take home advice to all women in perimenopause, so that you can keep disease as far from you as possible.